Hey everybody, I'm Dr. Josh Jagoda. Today we're going to examine a wrist. We had somebody who sprained their wrist yesterday or last night, so we're going to do a quick little eval. So we've seen this already in the past, so we kind of know exactly what we're dealing with, but usually a wrist is really sore, really painful, and last night you were telling me it shakes and had some spasms going on. So she's holding the arm up a little bit. What's going to end up happening is she'll end up getting some neck and shoulder cramping because she's always constantly holding this. So we may have to work in the future up there just to relax the whole shoulder girdle. But let's just examine what the wrist is like. So can you just kind of go up and down? Does it hurt a lot?
When I go up, it does.
More up than down?
Yeah.
Can I see the other one? Go down. Go all the way up. Yeah, so a little bit more range of motion on this one. And of course we'll look to see if there's any bruising and stuff like that, but there doesn't doesn't seem to be. So does it hurt over here?
Yes, it does.
What about over here?
Not that much. Oh, right there, yeah.
If we just pull it, does it hurt?
Mhm.
Okay, a lot this way?
No.
A lot this way?
Yeah.
Alright. And more, does it hurt a lot more?
Yes.
Okay.
Yeah.
So this is pretty standard. This is something we see a lot. Usually on the outside of that wrist bone here, there's a little bit of a triangular fiber cartilage right here, and there's really a lot of tenderness. And if we show it on this side, there'll be a lot of pinpoint tenderness. A lot of times what people will do, they'll fall, and what they'll do is they'll slam their wrist back and into extension like this, and that'll pinch off a lot of the ligaments down here. So this is often a really tender, sharp. It probably feels like almost like somebody sticking a screwdriver in there.
Mhm.
Really sore. It's gonna really weaken the hand here. So this is something really common. The good thing is there's not a lot of swelling in this one. So that's what we normally see with this type of injury, but this is definitely not showing any signs of swelling. Can you squeeze my hand? That hurt?
Yeah, when I squeeze
Okay.
hard.
There will be a lot of weakness, of course. So what we're going to do now is we're going to go in and we're going to treat this with Graston. The first reason we're going to treat it with Graston is so that we calm the muscle down, we calm the whole inflammation process down, and we get the person to kind of relax. Number one goal right now is just to reduce her pain levels. So we'll start by getting some Graston done. And of course we'll use an anti-inflammatory approach with this. So very soft, slow strokes using the Graston tool. So this should not be uncomfortable whatsoever. It should be really comfortable. Try to relax your arm. So we can go a little bit harder up into the muscles up here. It'll probably feel really good.
It does. It's like so relaxing.
Yeah, it's really soothing up here. When I go down into here and I kind of like get a little more finer, it'll feel more uncomfortable, which is why we won't go as hard. Try to relax the shoulder the best you can. So we'll also, of course, switch the direction of the tool going back down. We're also going to change the directions. I'm not pulling the skin or anything. You okay?
Yeah.
So this is just to loosen up the tissues that when I go back into here. Okay, so now just relax for a second. I'm going to go in with another tool, with a smaller tool, because I want to get in that small area. A little extended YouTube video for you guys out there today. So you can probably feel it right through here, huh?
A little bit, but it's not.
Exactly. So
crazy bad.
again, we were not scraping really hard. The last thing you want to do to a brand new injury is try to beat it really hard and expect it to get better. The body and the nervous system and everything needs to calm down. It's in a heightened sense as it is. So if you get a 4 out of 10 or a 5 out of 10, you just let me know.
Okay.
It should not be that. It should feel really good, actually.
Yeah, it's not painful at all.
So this will add a little bit of blood flow. Try to relax her. Sometimes patients will try to work too hard for you, and what they'll do is they'll help you too much. And you'll see that when they'll start compensating and holding their shoulder in a different position. This is going to be a little bit more uncomfortable. And of course, because this will like really affect the hand and the way it works, there's going to be weakness in the hand. As we saw before, there's a lot of weakness with pain. So we'll work into the hands, we'll pull onto the digits, we'll do a wrist mobilization to help all that out too. So let's go this way. We're going to work the back side too. This is where it's going to be the most painful because this is right where the ulna comes down and meets the wrist right here. So if you can't probably see on this side, but right here is where it's going to be really tender, right across this joint line. And so I'm going to have to go even lighter there. You feel it?
Yeah.
And I'm almost going like this, guys. So it's really like almost I'm like doing nothing, and she can still feel that. What I find is like a lot of people will get a lot of relief when we work the outside of the pinky because it'll loosen up a lot of this connective tissue and fascia right there. And of course, we're gonna have to tape her because, you know, she's not gonna be able to go out right now and just grab a wrist strap or anything like that. So to help increase the security of that wrist so that she can grasp a little bit better, hold things a little bit better, coffee cup or anything like that, we want to make sure that there's a little more stability. And so we support that with some kinesio tape or rock tape, and we'll do that, and we'll show you that in the future. All right, so we're going to continue on, guys. This is how we would treat it, but we're going to continue going a little bit more and a little bit more in depth. So stay tuned for the kinesio tape. We'll see you guys next time. Bye.